Hello and welcome to Sacred Psychology, the podcast for misfits and mystics. Here, neuroscience and spirituality go hand in hand. Join me, Tamara Powell, on a no-holds-barred adventure outside the box, because that's where all the truly great shit happens anyway. Welcome back to Sacred Psychology. I'm your host, Tamara Powell, and this is a show where we dive into all things related to neuroscience, spirituality, and today, sexuality, one of my favorites, and I know one of yours too. And we're not just dipping our toes in, we are diving head first into a really hot button topic in the world of psychotherapy right now. Porn addiction. Is there such a thing? Can we be addicted to a sexual behavior? Well, my guest, Dr. Jennifer Weeks, has much to say about the topic, and I gotta tell you, I was pleasantly surprised. This woman really knows her stuff and takes a very balanced approach, something that I hate to say can kind of be hard to find. So I can't wait for you to hear more about her plea for clinicians and society to please be more discerning in how we diagnose sexual and pornography, quote-unquote, addiction. But before we get into that, let me tell you a little bit more about this powerhouse. Dr. Jennifer Weeks is the founder and director of Sexual Addiction Treatment Services, which is an outpatient treatment program for out-of-control sexual behavior. She has over 12 years' experience treating all aspects of addiction, from trauma to sexual addiction and even sex offenders. That's a tough population for many of us. She's a certified sexual addiction therapist and supervisor. She's also certified in advanced alcohol and drug counseling, and she's a licensed professional counselor. Dr. Weeks is the author of the blog, Dr. Jen's Recovery Readings, as well as the prevention book. This is a good one, guys. The New Age of Sex Education, How to Talk to Your Teen About Cybersex and Pornography in the Digital Age. And in addition to her clinical work, Dr. Weeks provides continuing education training for therapists, and she lectures at addiction conferences. So I am so delighted to have her here today. Without further ado, I give you the one, the only, the ever incomparable, Dr. Jennifer Weeks. Hey, Jennifer, welcome to the show.
Thank you for having me.
Oh, I'm really excited about this topic. It hits all my faves.
Great.
You, my dear, are the founder and director of Sexual Addiction Treatment Services. And so instantly I'm drawn to that idea. And yet you and I both know that that is a stigmatized hot button topic, regardless for lay people and clinicians alike.
Absolutely, it is. And so, I started the business about 8.5 years ago. And honestly, that was really before a lot of this blew up.
Mm-hmm.
The controversy and Dr. Lay's books and,
Right.
all of this other stuff. And, I put up, thought of a name for the program that I wanted to work with because that was the niche that I worked with. And, that's what I was seeing in my practice. So I didn't really think about it.
Right.
We abbreviated as SATS because no one really wants to write checks to that.
Yeah, I can.
But, we didn't think about it. And then over the years, it's sort of blown up, honestly, more as a controversy between clinicians and things than it is for the people on the ground, the clients that are coming in.
Mm-hmm.
So we've left the name as is. And so I think our myself and the clinicians that work for me, our understanding of the issue has morphed over time and evolved over time, just the longer we're in the trenches working with people with these issues. So we're not big label people.
Yeah.
So, if you want to say you're a sex addict that works or, you got a problem, we'll come in, we'll talk about it, and we'll try to help you work through it. But I think, again, over almost, coming up on a decade, your philosophies on things evolve.
Yeah, no, totally. But I love that piece about what you said, because I'm constantly preaching that it doesn't matter what we label it, but if there's some distress or dysfunction,
right,
come on in and let's talk about it.
Let's figure that out.
Yeah, that should be the key. I don't know why that seems so complicated.
Well, and I have this discussion with my significant other who's a researcher, and he's doing all this great research, and I'm not the person in the university, I'm boots on the ground. And I'll be like, wow, that's a really great finding about addiction.
Right.
How on earth does that help me? Right.
Mm-hmm.
So you've got this gap, I think, that is very real. And that's a whole nother topic, which we're not going to talk about, between like, what are people doing in academia versus what are you and I actually doing, every day sitting here with our clients trying to help people.
You might have to come back on the show and talk about that one, because I teach sometimes at the local university, and that's a huge pet peeve passion of mine too. Mm-hmm. There's the gap between theory and applied.
Yes.
And sometimes it can be a pretty big chasm. So
it is. Which
does bring me to, I want to talk today about porn and cybersex, et cetera, not just for, couples and individuals struggling, but also, your book that just came out about, teens. And I've got a 15-year-old and a 12-year-old at home. And so that's definitely on my heart. But let's start at the beginning. That big elephant in the room, addict, addiction, that label. What is your take on that?
Okay. I'm going to try to see if I can
huge
condense things down. So, depending on, I think, your philosophical or licensing body, sometimes it's, how you feel about it. So the ASECT, the sex therapists, they absolutely don't think that sex can be an addiction.
Right.
And I get where they're coming from. It's a community of people. I just presented at their conference 2 weeks ago. They're a great community of people. But, they have a fear of sexuality being stigmatized and sexuality being, overly judged by this overly conservative view. And I think a lot of their their thoughts on that feed into, why they say sex addiction isn't a real thing. They say, well, there's not enough science. That's not really that true. There's starting to be a lot of, peer-reviewed, sound scientific work out there, neuroscience work, saying that, pornography is what most people study because that's easier to manipulate in a research lab, does hit the same reward systems, the dopamine reward system that, sugar does, that Coke does, that, amphetamines do, things like that. So that's sort of where they are. There's sort of this really diehard sex addiction therapist camp as well. And, I was trained in that camp where, sex can be addictive. And, it's if you're doing X, Y, and Z, this is a sex addiction. The DSM, which if you bill insurance as your Bible, says it doesn't exist, but the ICD-10 does. So like you're in this muck of what the heck is going on.
Yes.
Right?
And it does feel like muck sometimes.
It does. Yeah. So how I approach it and how the clinicians that work for me approach it is that, I do believe that sex addiction is a very real thing. I think it is really overdiagnosed. Whether
Thank you for
the media saying things or people wanting to use it as an excuse. So I think that's part of why it gets a bad rap, is because it is really overdiagnosed. But I think it's real. So a lot of people are now using the lingo of problematic sexual behavior. So, okay, it's a problem. Is it an addiction? Maybe, maybe not. For people we see that I would say do have a sex addiction, a pornography addiction, it's not casual consumption. It's not, something that distresses a partner. It's behaviors that are done in great secrecy, usually are accompanied by an enormous amount of emotional distress, shame. They can't stop. They want to stop, but they can't stop. So similar to substance diagnoses, right? They want to stop, they can't stop. It's getting worse. They're spending more time, more money, more energy, more resources into engaging in the behavior. It's causing disruptions in work, social relationships, marriages, things like that. And so, the person who comes in and, once every couple months has like a 6-hour binge on porn overnight when his partner's away, that person's not necessarily an addict. We have to look at what else is going on. But somebody who's spending hours and hours and hours a day and is now starting to look at porn at work and has been, put on probation because his employer knows what's going on and they're going to fire him, and they're doing all of these things despite severe consequences and they can't stop, then maybe we're in the addictive realm. The last thing I'll say on that is that really how we look at it, how I look at it and my folks look at it is, what is the person's relationship to the sexual behavior? It's not about the behavior. It's not about quantity or frequency or anything about that. What's their relationship to that behavior, and is that problematic?
Whoo, girl.
Sorry, I get
why you're amazing. No, I loved it. I was over here going, yes, 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 because you said so much that was incredibly impactful and practical in there. The first one being, let's not jump to conclusions.
Right.
That addict word gets thrown around so casually, and it's not just sex that it's used with that flippantly either.
Right.
It is incredibly idiopathic. I love that you were talking about, the guy who may binge on 6 hours. I mean, it kind of depends on what's your subjective version of normal, right?
Right.
6 hours
Absolutely.
is a lot of porn, but it depends upon, is he causing himself, right, tissue damage? Is there that sense of
absolutely
fame? Is he just enjoying the cinematography?
Is it, or is it just sort of his way of zoning out for a couple hours because he's had a really stressful week, and it doesn't happen all the time. So it's so personal, and I think that's why people struggle with that addict word too, where it's really easy at some level to say someone's like an alcoholic or a drug addict. Like, we've got these physiological markers we can look at, and there's physical withdrawal symptoms. And when you're dealing with a behavior that's more of a psychological addiction, perhaps you don't have those markers. So it's so much more nuanced and so much more complicated.
Yeah, one of the models that I love, and I am totally brain farting on it, I think it was the creator of the hippie, though, the heterosexual whatever behavioral inventory. Possibly, I could just be talking out of my ass now.
Rory reads
quite.
Yeah.
The end of the day, and I'm just a little fried. But the idea of the negative reinforcement cycle for anxiety as being a huge component to what drives sexual compulsivity.
Right.
I act out, then I feel even worse about myself, so then I have to act out again. And around we go. But for a brief period of time, it relieves that distress.
Well, and that's sociobiological, right?
Mm-hmm.
Like, at some level, we're all just creatures who need to propagate the species. So what is going to be more reinforcing than an orgasm? That's there's a reason for that.
Yeah.
So,
thank God. All the gods, whoever created it. Yes.
If you're using some kind of sexual behavior, to cope with negative affect or to, de-stress, it's going to work because that's biology. But all the rest of it is, the psychological stuff that gets very complicated. And
it can be, complicated, hard to pick a new favorite when you're upset, especially if you learn to imprint on that really young, for example. And now we're seeing these clients 20 and 30 years later, and there does seem to be some impulsivity and some compulsivity. Like you said, they just can't stop, and they override. And so whether we're calling it an addiction or not, there's still a problem.
Right. And that's something, and anybody who's coming into, particularly my office and probably yours as well, if you're coming into my office, there's an issue, right? Nobody's just walking into my office because they're having, a bad week. They're coming in, we specialize in this. They're coming in because it's gotten so bad that they're willing to get over whatever shame and stigma.
Come talk to a stranger, right?
Talk to a stranger about their very detailed sexual habits.
Yeah, it often starts in whispers, and I'm like, can you speak up? Can you say that again? And we got to do a lot of normalizing, which that could be a whole other podcast. Why is sex so stigmatizing and taboo? Because research shows that even feeds into this when it does become compulsive.
It really does. The shame is a big piece of that. And then that's what we see a lot with, people who were brought up in very conservative or very rigid families where sex is bad, sinful, taboo, or even just not even spoken about.
Right.
That as these people get a little older, your hormones start kicking and they're having sexual feelings. And, depending on how you were raised, just having that normal biological feeling is bad, is sinful. So, oh my God, I must be this bad person because I'm having a sexual feeling. And so that shame starts so young. And then a lot of people just carry that with them, and it skews their sexual lives until hopefully they can work through it.
Right. And not to mention the misunderstood or not understood often enough idea that the brain really does reward novelty and taboo with extra layers of those feel-good chemicals. And so
we get
that's
bored.
Also reinforcing. Yes,
we get bored. And I think a lot of what, we also see coming in are people that just have a fundamental lack of understanding of healthy sexuality. And I think one of the best things that happened in my practice is that, we got connected with and brought on a clinician. Her name was Erin, and she's a sex therapist, and, brought in a healthy sexuality component into our program, which has just been amazing. That instead of like, no, it's no, and hey, how about this? Here's some yes. But so many people just don't understand. And so, you'll have partners that will say, well, I don't want him to even be attracted to any other woman but me. Well,
Yeah, right.
I can't undo biology. What you're asking for is, fundamentally impossible. And
And
people who
unfair.
just lack knowledge.
Right. Exactly.
Yeah.
It is, in my opinion, unfair to ask biology to shift because of our desire to really possess another human being, not in a nasty way, but like love always wants to have that feeling of belonging, right?
Right. Or
And
whatever our
possession.
own maybe insecurities or anxieties are, things like that.
Yeah, and it can be scary to realize that your partner is looking at pornography genres that are nothing like you.
Yes. Or things that like maybe you're uncomfortable with or, absolutely.
I love starting from that conversation. Now let's talk about what's healthy sex. And let's talk about what's healthy sex for you and your worldview, whatever that is.
Because that's, again, different for everybody, which is why I think, you can't paint these issues with just a broad brush. It has to be individualized just because like every person's relationship with a sexual behavior is different. Their tastes are different. Their arousal template is different. And so it's just so individual.
I liken that to our menus. We each have a different menu
Yes.
of what we'd like to try, what we're totally not interested in, what's on our sexual script, so to speak.
If there's a buffet, I'm not going to want everything, but there's certain things I'm going to go to first.
Yeah, no, great. And that buffet analogy brings me back around to some of the overlap with the perhaps comparing it to addiction, and that, sex really is like crack or sugar to the brain. And, if you are starving, you will reach for a Big Mac or a donut when really what you're wanting is filet mignon, but it's there and it's a chemically induced high.
Right. And it's easy. And I think this is where, some of these behaviors, whether or not they're addictive can cause real relationship problems is that, we get a lot of people who come in and, one partner is looking at, a lot of pornography. The other partner is, obviously upset by this. And, there's two pieces to that, right? So are they an addict? Mm-hmm. Maybe, maybe not. But is their pornography use interfering with their intimate relationship with their partner? Frequently it is. And so it becomes parsing out, why are they doing that? And for a lot of people, it's just so much easier to get those needs met in that static realm of pornography because human relationships are so much work.
And a lot of men get, a sense of performance anxiety when we are introducing any partner. Women too. It's like we feel the need to put on a show quite often for our partner. And it
becomes that performance-based thing. And there's so much that goes into it. And so, you have, people who'll be like, well, intimacy is a lot of work and I have to deal with my stuff and his or her stuff and did I have a good day and all of those things. And it's just easier to kind of, masturbate, look at a little porn and go to sleep. And that doesn't feel good if you're the partner, right? That makes I'm difficult. I'm a problem. Like what's going on? And so in that kind of like overgeneralizing of addiction, we see a lot of couples that'll come in where one partner is really vested in the other partner being called an addict.
Yes.
Because then he or she has a problem and he or she's messed up. Because if they're not an addict, then like there's just something going, there's something going on in the relationship that maybe is not okay. Or, it's easier to blame the pornography and the addict than to actually say, okay, why doesn't my partner want to be around me? Or why doesn't, is he not in love with me anymore? Is he not attracted to me anymore? And that's not about me as a partner. That's about him.
You're right.
But all that can get personalized. So it can get some muddy water. And we've had a lot of partners who've gotten really, really angry with us.
Me too.
Sometimes. Because we're like, well, he's not an addict. Well, why would he be doing this? Well,
lots of potential reasons.
Huge, long list of reasons. And, some of it has nothing to do with the relationship even and just that person's own family of origin or trauma or attachment issues and all of those goodies.
Yeah, and that brings me to the flip side of things too, Jen, that sometimes there's pushback for the labeling of addiction because for the one who's quote unquote acting out, it can be an easy cop out for them too. It's easy to go, well, it's just an addiction. What do you think about that?
I hear that all the time, right? That people are like, oh, addicts will use it as a cop out. I've never had that happen in my office.
Mm-hmm. Can you say more?
So people are saying it, somebody's got to be hearing it somewhere. But, I've never really had anybody in my office be like, oh, well, I'm an addict. That's just what we do.
You know what I do have, though, and I would love to hear you weigh in on this.
Sure.
I have men, I struggle sometimes with 12-step models, which includes SAA at times and the various components, Sex Addicts Anonymous and some of the other ones, because, and I've attended those meetings and I have some of their members as clients, there is this notion sometimes, not all the time, of once an addict, always an addict. While they may not use it as a cop-out, there's sometimes this desire to own a label in a pathological, self-deprecating kind, and we just get stuck. And there's often this, as we're moving through treatment, this resistance around finally becoming whole and healthy again.
Right.
There can often be fear that pops up, and they want to keep, for example, their flip phones for the rest of their freaking lives because they don't trust themselves with the smartphone where they might get porn. What do you think about that?
I think a lot of that has to do with their shame, right?
Yes.
And there's some folks that you hear scuttlebutt now of, is even just the name addict a shaming thing?
Right.
And I think that's a lot of, how society, the context with society uses it. But I think, a lot of people, if they're still really shameful about what they've done or the behaviors that they haven't resolved, maybe their own upbringing's belief on sex and sexuality, get stuck with that addict label. We talk about sort of like the pie chart of who you are as a human. And if you do identify as an addict, it shouldn't be your entire pie, right? It should be a piece of your pie. And a lot of folks get stuck with that, like that's their whole pie and they can't see out of that. And I think doing a lot of shame reduction work has helped with our folks. We do, use a lot of Brene Brown's connection curriculum and, even old school John Bradshaw's shame stuff that, really work through their shame to try to help them see that, yes, even if I identify as an addict, I'm an addict, but I'm also 8 million other things besides that. And it's not the one thing that defines me. It's a piece of who I am. And, that what you said to like become whole, there's all those other things we have to work to develop to make the pie a full, great thing versus just like, I'm an addict.
Yeah. Human beings are so much more than that. Multidimensional. Yeah. I love that. Yeah, thank you for normalizing that. And I was also thinking about once again, the desire to perhaps, while sex may be as complicated or more complicated to put behind you when it's compulsive, right? Like while you can walk away from, example, unhealthy foods, you can just not buy them and have them in your environment. Kind of hard to leave your genitals at home. While it may be harder, we do, I'm assuming you do as well, firmly believe that people can overcome any of these difficulties.
I do. And I think it's a different model. It really is a different model from an abstinence model, which would be like an AA-NA model. And I think a lot of people, part of why they struggle with, sex as an addiction from an opposite realm than the sex therapist is like, well, if it's an addiction, you just stop doing it, right? You just stop drinking. Well, we don't want anybody to be monks. I tell my clients, I'm not the sex police, right? Like, part of being a healthy human being is having a healthy sense of sexuality, whatever that means for you. So it's more, I kind of look at it as more of a harm reduction model, right?
Yes.
Figure out what sexual behaviors don't work for you. Work on stopping them. And then let's make sure we're also really engaging in healthy sexual behaviors. So, it's not an abstinence-based model. It's a figure out how to have a relationship with your drug, so to speak.
Yeah. And I'll tell you what some of the hardest presentations to work with, at least in my experience, has been the incredibly conservative man who has no other sexual outlet. And he's wanting to abstain from sex until he's 25, 35, 40, or whenever he ends up having a wife. That's tough because we're talking about healthy sexuality. Right. And in his mind, there's nowhere else to go with it.
Right. Because it's supposed to be sex until marriage and no masturbation either.
Right. No lust.
No lust. And which is,
I love that you listed that in your blog. So I purposely brought that up. Tell me about that, girl.
Yeah,
Tell me.
It's just not human. It's
Thank you.
Possible.
Yes.
And it is a struggle because that's, and I think the writing you're referencing is the erotic conflict piece. And it's that we have biology. We are going to have feelings of some nature, and that's normal and that's healthy. And so when we're told that it's not normal or it's an unhealthy, we're creating a shame core just as a human being. A piece of me is inherently bad, is inherently shameful, and then find someone who maybe keeps his no sex until marriage vow, great, gets married at 30, but find me the person who hasn't looked at pornography at least once or twice or masturbated at least a few times until that. Like, it doesn't exist. So it creates, it must somewhere. I haven't seen any clients who have made it that far with zero sexual behavior.
No. I haven't.
So there's all this conflict, right? I have these feelings. I fight it. I'm bad because I'm want to act out. I want to masturbate. I'm bad. I do it. Oh my God, I'm a horrible person. And so you're just entering into, when you enter into a sexual relationship, you've now got all this baggage of sex is bad, sex is sinful, my sexuality is bad because I did these things I'm not supposed to do. And then we wonder why they don't have a healthy sex life.
Right. Hello. I often find, besides normally the
it's never going to happen,
right?
With all of that coming. Yeah. So it's really hard. And I think that's, on my end as a clinician, when we have clients from those really, conservative backgrounds, it becomes sometimes really hard to treat, to be honest, right? Because I don't want to disrespect your religion. That's your religion. That's your faith. That's your belief. Like, I respect that. It might not be mine. But then how do you say, okay, that's your belief, but here's what's healthy and normal and biologically normal. And sometimes, they struggle to hear that information because, again, it maybe doesn't fit with their beliefs or what they grew up with. And then trying to find a way to find healthy sexuality can be really hard because of all of the baggage that they come in with. So, as a clinician, sometimes that's really hard for me because it's like, oh God, this is why these messages are why you're so shamed about this, but how do I work with that in a way to respect their religious faith, but also try to explain what's healthy and find some common ground to move forward?
Right. And I have found both clinically and also this backed up in the research that there is a paradox that the more we push against something, the more we reinforce the cycle.
Yes.
Right. And so statistically, men from these religious worldviews, often the patriarchal Abrahamic faiths of like Judaism, Christianity, and Islam, we see a higher incident rate of problematic sexual behavior.
Yes.
Probably because of this shit right here.
Yes. It's like there's so much, baggage and shame and all, taboo and don't talk about it. And, versus how can we figure out how to still hold your faith, but also find a way through sexual life that's a lot more healthy. And I always laugh because a number of my, clinicians are also pastoral counselors, and they're not what I think you would stereotypically think.
Sure.
Because they're very much, healthy sexuality, let's go, and not conservative. And so it's kind of fun, from my end to be like, right, how do we go about this? Because they can bring to me the perspective from different, rather conservative faiths, and we can try to figure out how to help these people that come in seeking assistance.
Yeah, that's my favorite. Okay, what's coloring your worldview? And now how do we get you having fun and playing? Because, as the APA defines healthy sexuality, it's just being mutually pleasurable for us both, right?
Both, yes.
So let's stop putting so many freaking rules on it. And those rules can be adapted to anybody's spiritual worldview. But some of them are definitely trickier than the others. So for me, part of the thrill is in being able to normalize it even from their worldview. And if we're talking Christianity, first of all, you can't take that sacred text outside of the historical context. And those people were getting married between 13 to 16 before they had that biological drive. And you're trying to apply that to modern day Americans, say, well, sorry, you haven't met your wife before 40, you're screwed.
Right. Like it just doesn't, it doesn't work because we were, it's a time in history when you started having children as soon as you were biologically able to because of mortality rates of everyone.
Dead by 40, right.
Yeah. So it's a very different world, and it's so, God, I just keep using the word complicated. It's just so hard to navigate. It's really, so I always have great empathy, particularly for my clients that come from these really conservative backgrounds, because it's just like, God, you're every single day of your life,
right,
living in a way that you're trying to sort of navigate this biological reality in conflict with your faith life, that's exhausting.
Yeah. So humor me, if you will. Let's talk about another complication for this of, sexual trauma.
Yeah.
And we've got conflicting experiences there. And some of my, stereotypically speaking, female clients that weren't brutalized, but were rather groomed sexually.
Yes.
Get very confused when they may have hypersexual behavior, whatever we're labeling the criterion for that. And this disgust factor, shame factor, freak out factor. It's very confusing. Now, I know trauma is one of your specialties as well. So can you talk to me about the complexity and how we might work at that, look at that?
That's a deep one.
How do you comfort these people?
Well, and I think that, we kind of come at things at a multi-pronged approach, right? So, if someone is coming in, engaging in a behavior that is distressing to them, sort of phase one crisis phase is, damage control, and let's try to, help you stop doing whatever behavior is that's causing so much distress. And once we've got some emotional containment and some safety, maybe then we dig into the trauma stuff. And you see, with problematic sexual behavior, you see sexual trauma come out in so many different ways. In women, it is, as you stated, very common for that trauma reenactment of, women who were sexually abused as, girls or teens end up being what some might call sexually promiscuous, right? I'm not a big fan of that word.
term, but we all know.
You see it in the scientific literature all the time, which makes me a little
gross.
Ratty. Yeah. Because they're kind of reenacting their trauma, right? If I've been taught my only value is in my body, or if I've been taught the only way I can get attention is with my sexual behavior, I'm going to keep doing that.
How I got my needs met. Yeah.
Yeah, and it's rough because these are smart ladies and they know at some level what's going on, and it's just so hard to stop. So, in those situations, it's a lot of trauma work when they're ready. We've got, I do EMDR, and we've got people that do EFT and
fantastic.
A lot of trauma modalities.
Trauma first.
Yes.
Yeah.
It's rough. And what I see, and I do a lot of work with sex offenders as well, and one of the things, the first few times this started to occur, and the more I see it, it's, this trauma reenactment. I have a number of gentlemen who were sexually abused as boys, right? And boys hardly ever disclose that. Who are looking at child pornography. And when you start digging into what child pornography they're looking at, again, this is not everybody, this is, a handful. They're looking at videos that exactly reenact their childhood sexual trauma.
Thank you for saying that, because I am one of the few, besides yourself, and I'm sure, I don't know how many hundreds, maybe a few thousand other clinicians that do have empathy for offenders for exactly that same reason and have sat with them. And people are like, Tamara, how do you do that? You're a mom. And I go, right. But these were people whose innocence were stolen more often than not, number one. And number two, I'm one of the first lines of defense between
I was going to say, what better way to prevent something happening than to treat it? And when I do a lot, I have a great passion for working with offenders, and it's, talk about stigma, and that's again another topic, but, there are people who have issues and struggles. I don't work with, sociopathic, psychopathic offenders. I own my practice.
Their prognosis rating was terrible.
And I own my practice, so I say I don't want to work with you.
Yeah.
So, the lower level offenders, nobody wakes up and says, I think I'll become a sex offender. These are people who don't want to do this, who hate themselves for what they've done, who many of them have sexual trauma. And then the younger ones we're getting are just kids that started looking at pornography when they're 10. Well, if you're 10, what is age-appropriate pornography?
Ooh, girl. You said it. Yes.
Right? Illegal. Not good. We're looking at images of child sexual abuse. But if I'm 10, that's what I'm going to be looking at.
Right.
And for some of these young men, they start out at that age and it never goes forward. Or they'll continue to look at young as well as, maybe developmentally older as they go along. But, it's a piece of the things people don't like to talk about when they're talking about pornography and kids watching pornography.
Yeah. And that brings me to this other point that I've always had this stance on, but there's still not enough research on it, this idea of sexual imprinting.
Yes.
And there's something about when we've first have that huge rush of chemicals running through our body. This is also, in my opinion, how fetishes develop, right? You've got this, when nobody says, you know what, I think I want to screw a goat today, but it starts
with something.
Yes. And it, over time, if it's conditioned and reinforced over and over, the body's like, hey, remember last time that chick was wearing a really great pair of heels? And then
that was great stuff. Yeah.
Mm-hmm. And you see that chick walk by, and then it slowly starts to generalize. And then for lots of other complicated reasons, before you know it, you may end up with a fetish that you never saw coming.
Right.
But bringing it to what you were just talking about, that these young boys imprinting either on trauma or on what they're seeing in pornography. And in today's day and age, and I want to eventually get to your book, I mean, my children had smartphones by like age 10.
Yep. Average, and this is old data, so maybe this data is like 8 or 9 years old, that the average age of first exposure to online pornography is about 10. So, which means we need to be talking to children about it much before that.
Thank you. I'm with the American Academy of Pediatrics. Like, let's have conversations at each and every stage. Let's not have one big sex talk.
Young one.
Yes.
Yeah, well, no, and that's it. And that was part of why I wrote the book. But there's also, just as a resource for your listeners, there's an organization called Educate, Empower Kids. And they've got these great, just like little books for parents. And it's like 30 days of sex talks. And it's just like a little topic you could talk about, starting at very, very young children. And you're not talking about sex with very young children. You're talking about boundaries and body integrity and privacy. And
even body parts, calling them by the right name so people don't confuse them. Yeah.
Yeah. So, I mean, these are conversations you need to have. And so, I'm not sure what age bracket you're in, but I'm 45. So first exposure.
I'm right there.
Okay. First exposure to pornography, people in our age range was like, maybe we saw somebody's Playboy. If it was really risque, it was like a Hustler.
Right? Penthouse. Yeah.
Right. Which by today's standards, like you see on a billboard driving down the highway.
Totally.
Whereas, today, internet, maybe my first exposure is to rape pornography. Because that's just what I get. And so, the porn today is much more violent. It's much more, back in our day was much more taboo, is much more common. So it's not just that kids are being exposed to it, because that's going to happen, right? And, that's not necessarily horrible.
Nope.
But it's what they're looking at, and then do they have a good enough relationship with their parents to be like, whoa, Mom, you would not believe what I just saw.
Yes, and that's why you need to be having those conversations, so it is more normalized.
Yes, absolutely. So it's rough. And so you've got, there's starting to be some science, right? The pornography-induced erectile dysfunction is something that's gotten a little more press. There's some evidence for that.
I see a lot of that.
Yeah, what with the younger folks and the mostly men, obviously if it's erectile, it's men, but that's where our data is, that started out looking at a lot of pornography when they were young, become patterned to, it's really novelty, which we're all patterned at, but on hyperdrive, right? Yes. Like, so click, 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 it's constant novelty, constant change. And so some of those gentlemen, when they, get to the point where they're having a relationship or about to have sex with a live human, being.
And the same human.
Oh. Right. Well, even if it's live and it's a novel one, like we're static, like human, we just can't move that fast. We're not like clicking through YouTube. So that novelty isn't there, and that, constant change isn't there. And sometimes they struggle just to even be aroused to a human or to the same human more than once or twice. And, it can cause a lot of trouble. And I have one young gentleman I worked with years and years ago, and his arousal template was really around anime.
Ain't none of us built like that.
Right. And even if you can't live your life at Comic-Con. So you'll see somebody every now and then who'll hit it. But how does that person then end up having a healthy sexual life when, what they're aroused to is so narrowly defined and not actually really realistic?
Right, because show me a woman that's going to cosplay all day, every day. And even then, she's not exactly like a cartoon. And even then, there still is overlapping incidents with, a woman's vagina, as tight as it is, may not be as tight as your hand.
Right.
And as fast and hard. And so, when you can get yourself off in 2 minutes and 30 seconds, and it takes her 10 to 20, that's tough.
It gets real complicated. And I think some of that also, to me, speaks to... even still, today's day and age, there's very, very poor sex education.
Yes.
In the world, when I was writing the book a couple of years ago, I was like doing my research and astonished about the number of states in which, you do not actually have to provide factual sex education. It's just like, what do you mean? You can provide false sex education? Like,
even for other clinicians, I remember being a registered intern and doing my required hours for HIV training and having, because my specialization was always in sex, hearing this person presenting just god-awful wrong statistics and shaming statistics on like bisexual women being promiscuous and higher. And I was like, what?
Right. Yeah. And so there's just bad education everywhere, and that cycle of shame continues. So if my parents never taught me about sex and I learned from my buddies on the street, and then here I am in a relationship and I have kids, and how am I supposed to teach my kids about sex if I carry shame and taboo and misinformation? And I'm boggled by our country's relationship with sex, that, I can watch seriously graphic, basically porn on like non-cable television.
Or that too. Yeah.
And then cable television is,
forget it. Yeah.
Right. But I can't have a conversation about it.
No, and I think the world genuinely, for great reason, is both boggled and laughing at the United States for its relationship to sex. I mean, we've got the highest rates of teen pregnancy, teen abortions, teen STIs, and adult use as well. And we've got the shittiest sex education. Do you think there's a problem?
Right. Like, it's just mind-boggling that I don't want to talk about it, but I'll be driving down the highway and there's a billboard for beer with a 3/4 naked woman or something on it. So
yeah, one of the most interesting distinctions I've heard mentors and colleagues talk about is how sex does not necessarily mean erotic. Like, nudity does not necessarily mean erotic. And there's this prevailing idea that Americans over-sexualize everything.
Yes.
But there's a lack of intimacy and awareness, etc.
Yeah, I think, we have, and it's probably not just us, but the level of human objectification is enormous, whereas the level of kind of intimate connection, keeps decreasing.
Which brings you back to that whole fast food analogy then, right? Yes. It's like we're settling for Big Macs when really there's not a whole lot of, nutrition in there. Our bodies get it, they process it, and it's like, now what? What do you want me to do with this?
Versus like, hey, wouldn't that Michelin-rated restaurant be really nice to try every now and then?
Yeah, so we are literally starving ourselves into obesity and into problematic sexual behaviors because there's that craving for intimacy and connection. And we're just
we don't have. Yeah. And it's so, I do a lot of education and teaching around sex addiction, I think, because, I'm willing to talk about it and I try, hopefully I'm successful in coming across as non-judgmental and non-shaming about it, is that sex addiction, however you wish to look at it, is not about sex.
Right.
It's an intimacy disorder.
Ooh, there's a tweetable moment.
And that's, I'm sure that's not mine. I mean, we say that.
Don't care. Say it again, louder for people in the back.
It's an intimacy disorder. This is about attachment. This is about trying to get controlled intimacy, right? Because you can't necessarily control intimacy with another live human being. I can control my intimacy with a chat or with a webcam girl that I am paying to do what I want her to do. I can control all that intimacy. It's an intimacy disorder.
So good. So, Jen, you're definitely going to have to come back on the show because I have like 3 more topics I want to dive into.
I was going to say, you and I and a cup of coffee could last 6 hours.
It'd be amazing. And it would be the best. And I'd need a Jack and Coke and a cigar afterwards.
That would work too.
Tell listeners a little bit about your book first.
Okay. So that actually came out. When did it come out? Last year. Available on Amazon. It was a labor of prevention in my brain that we have lots of ads for prevention for drug and alcohol abuse. We don't have anybody talking about prevention for sexual issues. And every book, like editor and agent loved it, but they were like, we can't sell this. You're talking about like sex and kids. So it is a self-published thing. And so it's The New Age of Sex Education, How to Talk to Your Teen About, I think it's porn and cyber sex in the digital age. It's on Amazon. I'm going to own that part of it is outdated already, right? Because it's talking about technology and apps change every 5 minutes.
Yes.
But what some of my passions around that are really talking to parents, right? Helping parents understand what their stuff is. I use the word stuff. Like, what's your stuff that gets in the way of you having healthy conversations about your kids, about being in denial about what your kids are doing online because they're doing it.
Mm-hmm.
They're sexting, they're getting sex, even if they're not sending them, they've seen porn. And then really talking about, resilience training versus keeping kids away. You can't keep kids away.
Nope.
Why don't we just teach them to be informed consumers, to be knowledgeable, to have some resilience, to know what to do if they come across something they don't understand?
Well, this mom and therapist is cheering you on and so very grateful for you. Yes.
Thank you.
Thank you for being you and for doing what you do and for sharing your time with me today.
Absolutely. This has been a blast.
I'm so glad. And you'll be open to coming back?
Absolutely.
I got that on tape, y'all.
I'd love to come and chat. Absolutely.
Stay tuned. Thank you, Jennifer Weeks, Dr. Weeks. And I'm going to have links to all of the things in the show notes. So don't worry about trying to pull over and grab it now. We will have that for you.
Awesome.
Thanks for listening to the Sacred Psychology Podcast. I pray you found some inspiration and empowerment to go out and make this life the most fulfilling possible. You can follow Sacred Psychology on Facebook and YouTube. If you haven't yet, please go to Apple Podcasts and subscribe, rate, and review this podcast. Tag us on social media and let us know what you think as well. Please note that the information provided is not meant to convey professional, psychological, or medical advice. If you could use such services, I highly recommend seeking them out from someone you trust. To get in touch with me personally or to see how we might work together, please check out ariatherapy.com or talesfromatrapezoid.com. Until next time, everyone.